Governor Charlie Baker is diving into his first week in office, facing a slew of challenges that, in his words, have been left to fester for too long. Whether that's true is a matter for political debate, but on at least one issue, Baker seems to be in lockstep with his predecessor.
Last year, Governor Patrick called opiate addiction a public health crisis. He was right. It is a crisis. It's one that cuts across every community in the Commonwealth.
Now, recovering addicts and those who counsel them are watching closely to see if Baker keeps his word. As the governor charts the next course for Massachusetts, WGBH News senior reporter Philip Martin looks at the challenge of battling the state's opiate abuse epidemic.
Here in Central Square, the Cambridge Needle Exchange has called a lifeline to those struggling with addiction.
This place has been very important to me.
Carol considers herself fortunate. She's in recovery, but she's lost many friends to heroin and painkillers.
It doesn't matter where you come from. You know, you can have money. It doesn't matter. Addiction's a disease.
She's joined by her husband, Robert Valerie, who's also in recovery. He got addicted to OxyContin when he was recovering from a job injury.
So, of course, your doctor says, take it, you're going to take it. And I took it, and I got addicted to it, and I couldn't get off of it.
Programs like the Needle Exchange are on the front lines in the fight against drug addiction. And program manager Jamie Zimmerman says the numbers are discouraging.
This has been sort of a ticking time bomb, if you will. We've seen a massive increase over the past decade in the number of prescription, opiates that have been flooding the market.
The current epidemic started in the late 1990s, when OxyContin was first widely prescribed as a painkiller. But Zimmerman says the problem has been compounded by easy access to heroin.
Because it's much more abundant and it's cheaper. So if you try to get oxys or anything on the street, you're talking about $80 to $100 a pill, whereas a bag of heroin will cost you $10 to $15 for the same effect.
By some estimates, a staggering 10% of young adults in Massachusetts are abusing opiates. And those numbers cut across class and color, says Jason Moscato.
This is something that crosses all social economic groups.
Moscato is with the Riverside Outpatient Center in Cambridge, Somerville, and Wakefield. He sees many middle-class addicts that belie the junkie stereotype.
It isn't someone that you see on the street or anything like this. This is a person who still is functioning, but is addicted to opiates. So, she might still be bringing her kids to soccer practice. She is still married and still maintain things, but she is addicted.
Moscato and Zimmerman applaud Governor Baker's call to action, but they hope he follows through by adopting proposals from Governor Patrick.
She convened a task force to come up with recommendations on how to spend the $20 million in funding that he promised, and that include increasing treatment beds, which we desperately need.
Also important, better monitoring of prescription drugs and expanding the use of Narcan, which counteracts the deadly effects of overdose.
It's been well over 2,000 people, the actual lives have been saved because of Narcan. And we've done about 120 just last year alone, rescues, and it's 120 lives.
And for those in the grip of addiction, it's also just knowing that people care.
People feel like they're not recognized and they're already depressed and struggling, so just to know you have that support it's tremendous. It's a blessing.
Well, Adam, I have to tell you, I think that Governor Baker's truly animated by this issue. I don't think it's something that he's just playing with. I think he's really almost obsessed with this issue because it's affected so many people he knows. He's actually made it a point of calling various individuals whose sons and daughters have died and expressing grief and concern about this condition. And he knows it's something that's going to impact and is impacting Massachusetts deleteriously.
Of course, he was in the news recently for not getting an anecdote in his inaugural speech quite right that involved opiate addiction. But you don't think that's a big deal, right?
No, I don't. I think that I think you can mess up a story, if you will, but the essence of the story is still correct. I think that the bottom line is that he messed up a lot of the details, but in the final analysis, the young man died as a result of opiates.
All right, Philip Martin, thank you.
Thank you, Adam.
So will Governor Baker follow through on his promise to confront this issue? Jonathan Scott is the president of Victory Programs, a nonprofit that provides mental health and recovery services. Jonathan, welcome.
Thank you, Ed.
With the population that you deal with, how widespread is opiate addiction?
Well, opiate addiction it absolutely is epidemic proportions, and we have waiting lists in all of our programs that are weeks long, so people trying to seek treatment can't get into treatment. So one of the major and first interventions that would really help this epidemic in Massachusetts, and especially in the city of Boston, is the number of treatment beds and increasing the treatment beds, and especially considering the beds that were lost when Long Island closed.
How many treatment beds were lost there? Because we hear a lot about the 700, if memory serves, homeless beds, but how many treatment beds were lost?
There were 160 treatment beds that were funded by this Department of Public Health, and there were other treatment beds that were funded by the city of Boston. So,
and have they been replaced at all?
They have not been. The statewide programs have not been replaced, and we are really appealing to the mayor of Boston. It's, you know, this is such an amazing city that has been so supportive of recovery and treatment for decades and decades, and the city that's also been able to ignite the enthusiasm to bring the 2024 Olympics here really could help open up a group home and a detox that's so desperately needed and help the agencies that were so decimated.
You say that there's a shift in the people you're seeing get addicted to opiates. What is that shift?
We see, I think, in the 40 years I've been in working at Victory Programs, and this is my 40th anniversary. I started at 18 in 1975. Thank you. We are seeing a shift in socioeconomic, middle class, and absolutely younger people experimenting with harder and more serious drugs early on, and many, many parents really beside themselves trying to get help for young adults.
Do you think that's why it's become such a sort of front and center issue with, among others, the governor saying he wants to make this a priority? Marty Walsh has talked a lot about it too. Is it because it's become a middle class problem?
I think that we have, I think absolutely yes. I think that we have had a heroin epidemic for 40 years. When I hear people talk about the bad batch of heroin, and every time there's 2 or 3 deaths that comes up again, the bad batch, does that mean all the people I've known who've died over the last 40 years died of good batches of heroin?
So your advice to those of us in the media is don't talk about bad batches.
I think any time you use heroin, whether you snort it, inject it, or smoke it, you take your life in your hands, and it's a horrific risk on your body.
Governor Baker has talked about things like ramping up education involving opiate abuse, tracking prescriptions that are written for drugs like OxyContin, and also tracking overdoses. Do those sound like smart measures to you? And whatever you think of them, what else might you suggest?
You know, I think in the long menu of interventions and prevention efforts we can do, I would say none of that is bad or wrong.
You don't sound too excited about it, though.
I think it will give you more information. I think what excites me, and I think for those of us who work in the addiction treatment field, is treatment works, and that that we have an incredible system of long-term recovery homes, and we need more. It's, you know, for an agency like mine to turn people away. Today we had to turn a woman away who called us because of the program that closed on Long Island. We couldn't offer her a bed, and that's inexcusable in this state of Massachusetts.
You mentioned to me that insurance frequently does not cover long-term treatment for addiction, right?
It never has in Massachusetts. So
in other states it does?
And in other states it does, and in other states they're different models. So I think one thing that would excite me is for the governor to really look at the insurance industry and providing support for longer-term recovery, the 4 to 8 month models, where people can really get stable, where we can really do long work around family reunification, around helping people find housing, around getting them back into the community.
Now, my sense is that the stuff you're talking about would require a serious investment on the part of the state. Am I wrong about that? Or would it be expensive to provide those things?
You know, where we put our values, where we put our money is where we put our values. And yes, it would require an investment on the state, and that for many decades the state did not invest in the addiction treatment field. I mean, still today, I'm offered $4.72 to treat an adult man or woman, feed an adult man or woman 3 meals a day.
$4.72.
$4.72. You can't buy a latte at Starbucks for that.
All right, Jonathan Scott, thank you.
Thank you so much, Adam.